A dog recovers from a severe illness and heads back to the local park. To the owner, it looks like a clean bill of health. But for the next 6 months, every time that dog marks a tree, it leaves behind a highly infectious, lethal pathogen. The threat is infectious canine hepatitis, a disease caused by canine adenovirus 1, or CAV1. It is a worldwide disease. When it sweeps through a kennel or a shelter, it spreads rapidly. And for young, unvaccinated puppies, the mortality rate is exceptionally high. The virus mounts a systemic assault. Within days, an infected puppy develops a high fever, severe abdominal pain, and seizures, while healthy tissue begins to turn necrotic and die. Usually, a pathogen this destructive burns itself out quickly because it kills the host before it can move on. But CAV1 manages to spread successfully across global populations, thriving in the exact spaces where dogs gather. The virus exploits the way dogs naturally interact. Every time dogs engage in sniffing, licking, and close physical contact, they expose themselves to microscopic amounts of infected urine, feces, or saliva. The evolutionary advantage of CAV1 lies in the animals that survive the initial infection. Long after their fever breaks and their appetite returns, recovered dogs continue to shed live virus in their urine for at least half a year. Many viruses are enclosed in a lipid envelope that dries out quickly in the environment. CAV1 is a non-enveloped DNA virus. Without this fragile outer layer, it survives on kennels, water bowls, and grass for days. Because the virus lingers on environmental surfaces, shared spaces like dog parks and boarding facilities become invisible biological minefields for unprotected animals. By turning a dog's natural social behavior and long-term recovery into a delivery mechanism, CAV1 builds a persistent network of infection right under our noses. The infection enters through the nose and mouth. Once inside, the virus immediately starts replicating in the tonsils and the regional lymph nodes. This localized replication builds up until the virus breaches the bloodstream. This critical phase is called viremia, and it allows the pathogen to travel to nearly every organ in the body. The primary target is the liver. The virus invades the hepatic tissue, causing massive cell death and jaundice, while simultaneously mounting a secondary attack on the kidneys. As it circulates, CAV1 attacks the endothelial cells lining the blood vessels. The vessel walls weaken and rupture, causing catastrophic internal bleeding that the dog's body cannot clot. A highly visible sign of this internal damage often appears in the eyes. As the dog's immune system reacts to the virus locally, fluid builds up, creating a cloudy condition called corneal edema. Veterinarians know this as blue eye. Once the virus hits the bloodstream, the combination of widespread organ necrosis and the dog's own aggressive immune response creates an inescapable cascade of systemic failure. To stop the disease, early veterinary medicine developed a vaccine made directly from a weakened strain of the CAV1 virus. The vaccine generated the necessary antibodies, but it contained a fatal flaw. Dogs receiving the injection developed severe adverse reactions. Because the vaccine contained the actual hepatitis virus, the immune response triggered the exact symptoms the shot was meant to prevent. Vaccinated dogs suffered from kidney damage and the painful, blinding blue eye. Veterinarians were forced to pull the vaccine from regular use. Without it, the global dog population was once again vulnerable to a highly fatal disease. The direct scientific approach had hit a wall. Stopping the hepatitis virus would require an entirely unconventional immunization strategy.
The solution came from an unlikely source, Canine Adenovirus 2, or CAV2. This is a completely different pathogen responsible for kennel cough, a strictly respiratory disease. While CAV1 targets the liver and CAV2 causes a cough, these share an identical outer geometry. This structural similarity allows for cross-protection. A vaccine for CAV2 triggers the immune system to build antibodies that perfectly lock onto the deadly liver virus. By vaccinating against a respiratory cough, veterinarians provide dogs with full immunity against the fatal liver disease, completely avoiding the dangerous blue eye side effect. Infectious canine hepatitis hasn't been eradicated. It remains incredibly rare today because a clever viral decoy hidden in routine puppy shots outsmarts it, allowing millions of dogs to live and play safely together.